Okay. All right. So we'll just get started right off. I am Chelsea. I'm going to take us through our progress report for our Community Health Improvement Plan today. There's been a lot of movement in a pretty short amount of time. So we released our new Community Health Improvement Plan in December for that's our 2028 plan. And there has been a lot of good things to report. So we're going to get moving on that. I'm going to share my screen. Here we are. Okay, share. And let you. Can everybody see? Okay.
We're seeing the presenter view, just so you know.
Oh, interesting.
Are you using multiple screens?
I am.
Switch screens, reverse the screens, maybe. There
There
you
you
go.
go.
There we go. That worked?
Mm-hmm.
Okay. So, all
We
right.
won't be looking ahead.
Okay. So this is our progress report. We have a lot of wonderful things going on, but I'm just going to frame it up for everybody. So the 2028 CHIP domains, 5 of them are the same as the domains that we have had in the past, and those are the first 5. Healthcare access was new for us this year, and obviously that was precipitated by several different events that kind of all happened within a short period of time from one another, one of which being the closure of the maternity unit at Health Alliance Hospital, one being the abrupt closure of the Neshoba Valley Medical Center, and just the mounting healthcare crisis in general of lack of providers. We are in one of the regions of the state with the lowest provider to patient ratio. So that has been added to the CHIP as a domain in and of itself. I'm just going to remind everybody that this is our theory of change. So when we took our previous community health improvement plan out into the world and spoke with various community groups, so we kind of did a little tour of the region, held several community meetings in various parts of the region, and spoke with about 160 different people who we did an exercise that was a what we called a key domino analysis, and we asked, all of these things being equally important, because we're not asking you to prioritize what things are the most important to people's health, but which things are driving the others. And so this is the way it's stratified out, which were that the boxes in green: mental and behavioral health supports, safe and affordable housing and shelter, and affordable and culturally appropriate healthy food, were the things that we have essentially the least direct impact on as an organization. They're what we call the conditions for basic human health. Everybody needs them. We have wonderful direct service organizations that work in those spheres providing those, and so we support them. And how can we as an organization support them? So we move down to the next level. In orange, we have our learning environments and living wage jobs. And so these are the environments that people spend the bulk of their time in. And then the 4 pieces on the bottom are the key drivers that everything else relies on. And so without anti-racist systems, strong connections and collaborations across our community groups, affordable, reliable, and convenient transportation across the region, and policies and funding that support all of these systems, none of this could be moving forward. And so because of the type of organization that we are, this bottom area is where we spend most of our time. So those are the foundations that we live in. And now we have a team, and I'm very excited. So I think it's no secret that I was devastated when we lost Rosa, because Rosa, I used to say, was like more than doubling the capacity of the organization when we were able to hire her, because she just had so much institutional knowledge of how we work and the region in general. And so Rosa herself was irreplaceable. However, we have been very lucky to bring on a fabulous team. And so from the bottom corner left is Lois, who came on board. Lois Lunowitz came on with us for a project for the Neshoba Task Force to do some community convening and some interviews in the community around the impact of the closure of Neshoba Valley Medical Center. And when we got a grant from the Mass Department of Transportation to do a regional coordinating council, we were able to keep her after that project ended. And so now she is going to be coordinating the regional coordinating council and doing some other community engagement work for us. In the blue is Sarah, who likes to stay in the background, but she is wonderful with our communications. All the newsletters that you're getting, if they look way better than they did when I was doing them, it's because Sarah's doing them. And she's been fabulous with the website, which really has a lot of wonderful new things going up all the time. She's been doing fact sheets for us, and has been pushing me to get started on our annual report, which will be coming out in September, October. And that is good because I usually like shut everything down for like a week and do it before right before I need to publish it. So we're gonna not do that this year. Next to Sarah is Wendy Aguilar, who has been on our board, but is also now doing, she's taken over the Spanish speaking ambassadors group for us, which is really good because one of the objectives that we had in our previous CHIP was to be more inclusive of our Spanish speaking population year round in all of our events and all of our publications, and have more of a direct line to those voices and those communities, rather than kind of coming in and out in a less engaging way. And down here in the purple with the Rockin' Our Youth Council sweatshirt is Sarah, who is has been on our board as a youth council member and is now our youth coordinator. And so she's been, we're closing out our second cohort of the youth council, and Sarah has just taken that role on very recently, and she's doing an amazing job. So I'm super excited about our team. All right, so in our updates, I'm going to front load healthcare access because there's just been a lot of really exciting things to report here. One of our goals was for this chip was to assess the impact of the closure of the Neshoba Valley Medical Center and advocate to restore critical services. The UMass system will be opening a standalone emergency facility, that is SEF, in Groton in 2026-27. They're aiming for late 2026. They do have to build from the foundations up. They purchased land. They were not able to work out a deal with the current owners of the Neshoba Valley Medical Center property. And so they will be unable to use that property, but they're moving forward with a new SEF in Groton. And so Eliza is here to talk about the transition from the Chana working with the governor's task force to our ability to continue doing this work in the region. Eliza, I'm going to pass it to you.
Great, thank you. And I apologize, I'm at a conference, so I'm on my phone. And so dealing with the technology related to that as well. Thank you for inviting me. I'm just going to be here briefly, but I am Eliza Lake. I'm the Director of Health Policy and Strategic Initiatives at the Executive Office of Health and Human Services. And one of my roles is to co-lead, be one of the leaders of the Advancing Health Equity in Massachusetts initiative, which has identified 30 communities in the state that have high levels of health inequities, particularly around maternal perinatal health and cardiometabolic health, which is stroke, hypertension, diabetes, et cetera. And so Ayer has been one of those communities, as well as some other communities in your catchment area. And I'm really pleased that yesterday the governor announced, and I know the press release went out yesterday. I don't know if it's in any local news, but as you can see on the slide, that Amy's group, which is Amy still here? Sorry, I'm scrolling on my screen.
Yes, still here.
Okay, well, so then Amy, you should announce, but it's just so I'm so excited to be here and to meet all of you. And when oh, there you are, you're underneath. So would you like to make the announcement, and then I can talk a little bit about AHEM?
Sure, happy to make the announcement about the grant. So we are very pleased to award Chana 9 with a $250,000 grant over 3 years to really build on the momentum that has built up through the working group and through all the great work that Chelsea's been doing in the region. And my colleague Jenny just popped up on camera as well. We've had a long-standing relationship with Chana 9. It's such a trusted partner, and so we are pleased to provide this support and work together to advocate for some novel solutions that can really help improve health in this region. Thank you.
And I would, yes, so thank you so much, Amy. I mean, we are so grateful for your leadership in funding this, and obviously for Chelsea and all of you for the work you do in North Central. This is part of a larger initiative, which is really looking at how do we create public-private partnerships in these 30 communities to either, like in this case, build coalition and work with the community, lift up community voices to determine how are we addressing the health inequities in those communities. Some communities already have coalitions like yours, and so how can we support the work that you do to come up with interventions around specifically maternal and perinatal health or social drivers of cardiometabolic health, which of course can cover lots of things like transportation, and really address the needs of those communities in very specific ways. And so this is, I think, very exciting that the secretary and the governor are really committed to this place-based work, where the community is the one deciding what needs to be done, not the state, and that we are not only supporting that with helping build these partnerships, but also then providing technical assistance as needed, and then finally taking what you and Chelsea's group will learn in the community and bringing it back up to the state to inform policy and procedures that we have there to ensure that we're responsive to community voices. So I think is there anything else, Chelsea, that you would want me to say?
No, I don't think so. We're really excited about this partnership and really grateful to the Health Foundation, for the investment itself, but also for the multi-year commitment, which really makes a huge difference in a community like this where we know that it's going to be, years worth of building to get to a point where these systems are in place, and we have these community-based solutions, and so I'm really just very grateful that we don't lose the momentum that was built in this community, because the community has been so engaged, and they have some really insightful ideas about what they want to see happen. And so I'm really excited and grateful that we're going to be able to start moving forward and acting on some of the things that they are prioritizing and that they're excited about. So thank you again, Health Foundation. And it's just lovely to have the state, behind it, and have the kind of that visibility at that level. I think that's wonderful. From a funder's perspective, I think that's great. But it really elevates the community, and so we're excited to see where this goes.
As are we.
Yeah.
So I'm going to jump off, but
Yes,
thank you
I
all very
will
much.
let you go. And then, so there's several other wonderful programs and projects that are happening under healthcare access. I will just talk a little bit about my icons. So you'll see all of them right now are the forward icons, which just means yay, this is moving. This is moving in the right direction. There will be others on other slides that you see. So the Maternal Care Hub was another goal of the CHIP, and increasing home-based supports for birthing people. So we are partnered now with Haywood, which has a grant through the Department of Public Health to host a maternal care hub in the region. Populations that will be of focus will be folks who are in recovery and or have substance use disorder, and birthing people who prefer a language other than English for their healthcare. And we will be working with them. They are also working to bring more doula services to the region, and so that is a significant part of the project. We will also, this is just getting started. The hub is 2 meetings old as of next week, so it is brand new, and we have high hopes for really having expanded and very inclusive services in the region, and are very grateful to Haywood for stepping up into that space as the only maternity care unit in the region now. So a lot riding on them, and we're really grateful for that partnership. We are also partnered with Growing Places and Ginny's Helping Hand to advance access to produce, fresh foods, and maternal care supplies and baby supplies, along with community health worker bridges to services. So community health workers will be using this delivery of food and maternal care items to do some screening and referral programs with the clients who are referred through their OB's office. And so that is kicking off. We just finished the planning stage, and so we're about to move into implementation of that program. In another exciting announcement is under improving telehealth uptake, we did just receive a $20,000 grant from AARP. That's one of their flagship grants to convert spaces in 7 public buildings in the Neshoba region. So libraries, senior centers, we'll be working with the towns to identify some good spaces, but to convert those into areas appropriate for telehealth use. And that's a region where not everyone has access to internet or reliable high-speed internet in their homes, and where many seniors may not have the digital literacy to have telehealth appointments comfortably. So we're looking to, that's a very short-term grant, by the way, that has to be completed by December of this year. So there'll be some digital literacy trainings of staff and users, and some small time space conversion. Gary, did you have a question?
Yeah, so have the 7 public buildings been identified at this point?
We're going to be working with the towns to identify which ones are the most appropriate.
Okay.
Yeah. So hopefully we'll have one in each of the towns in that region. It may end up being that we have, 2 in one and don't have one in another, or they already have a space that they use for that. So we have to do a little bit of work with them to figure out which spaces will be the best ones. Good question, though. The grant hasn't actually been announced yet. We know, but it won't get announced until next week. And then it's like, hurry up, because you've got 6 months. Community health coalitions, we are looking to, we're doing some advocacy around SAFE 2.0. So SAFE, if you're not familiar with it, is the public health excellence fund and law that now provides much more support and also some like regulation around the departments of health, the boards of health in communities. So what training they receive, what they need to adhere to, but also provides them with some funding. And so we are advocating that community coalitions that are public health focused have access to some of those funds, in terms of not having boards of health have to redo the work of community building and community engagement if that isn't their current focus. And a good example of that is our partnership with the Neshoba Associated Boards of Health. So we've been really we're advancing that model of a public health coalition working with an associated board of health, and how I think that is a best practice. And let's see, policy reform on the privatization of healthcare and improving access and affordability overall. There are several bills that we are advocating for, and we'll be continuing to send out information on as they move through the process. But those are fairly, well, they're not new, but we have partner organizations that are really leading that charge. And so we tend to just kind of put out the information that they're sending to us. All right. Moving to transportation, housing, and the built environment. That is another area that we kind of been rocking it in. Like there's been a lot of movement, and it's been really exciting because transportation has not moved much in this area in a very long time. And so I want to first thank the UMass DON process, because that funding allowed us through the Anchor Collaborative to identify workforce development and transportation, and also to identify the need for transportation for our public services in terms of people being able to access the services of our anchor organizations. And so because of the work with the Anchor Collaborative, we were able to hire consultants who have put together a regional mobility master plan for us. It is near completion. We will be ready to roll it out a little bit later this month for comments and feedback. And then I think by the end of July, it will be 100% ready. I'm just checking the chat to see if anybody, okay. All right. So that plan, there's never been a regional mobility master plan for the region. And that is really important because the way Massachusetts is structured, we're essentially 351 independent fiefdoms, and there isn't always a lot of collaborative services, shared services, and transportation is such that you do not only need to go within your own town. So having a regional plan makes a lot of sense, and is something that we're really looking forward to having. Part of that plan was to start a regional coordinating council, and that is, we finally got that started. So the Regional Coordinating Council is funded by our MassDOT grant, and will be essentially all of the towns, so town leadership and social service organization leadership throughout the region coming together to talk about essentially triage in situations in which people are not getting, clients or residents are unable to get where they need to go, and how can we be doing that? And if we can't solve that within the people in the room, then those are things that we really identify as gaps, and then how do we move that up into something that's solvable either at the partnership level, or do we need to bump that up to does there need to be a new grant? Does there need to be more investment? So it's really going to help us identify where there are perceived gaps simply because there's a lack of coordination, or where there is duplicative services or inefficient services, maybe 3 or 4 organizations that are all making medical trips to the same location and passing each other by as they go. And so we're really excited about bringing some collaboration and efficiency to our public service transportation. And then the Transportation Management Association is the other, the partner to that, and that's how are we moving our workforce? How are we giving more people access to our larger organizations? So the partners of the Transportation Management Association are large employers along the Route 2 corridor. And then we're looking with them on how do we promote services that will get people from those outlying communities into those places of employment. And so that our anchor institutions can do better recruiting locally. And so that will be living under the North Central Chamber of Commerce. And we're very pleased to have them housing that. And it will be operated currently by Transaction Associates, who've done the consulting work on setting that up. They are experts at this, and so they were brought in to really help us set up an organization that would work. And so that is really exciting and ready to be launched by the end of this month. And I'm going to skip. So there's some other things that are doing okay. So I will say, so that the X is on, we had a goal of increasing emergency shelter options and promoting and supporting increased resources and pathways to self-sufficiency for shelter residents. I'm going to be flat out honest and say we are going backward in that as a state. Honestly, there are our family shelters are closing, and it has been really difficult to. We've advocated for them to stay open unsuccessfully, and bringing alternative housing online is, I know, a goal of like statewide, that we are in a housing crisis. Stay tuned. At the moment, it's not going well. Not everything can be going well. Also, as for like long-term affordable housing solutions, especially like local ordinances and things like rent control, the Community Preservation Act, zoning, these are potential topics for the Regional Coordinating Council. So there's been no significant action on them yet. Keep in mind, this is a 2028 chip and we can't do all of the things at the exact same time. So we do have some other things here that are partner-led. And so those little icons with the hands indicate that we are participating in some partner-led work in those areas. I am gonna skip to the age-friendly announcement. So we just announced in at our April legislative breakfast that we have been accepted into the AARP age-friendly initiative, which is a nationwide initiative, and I can't remember how many towns nationwide are part of it at this point, but it's a commitment to become age-friendly, and we joined it as a region with the lead partner being the city of Fitchburg. So that is Mayor Sam Squalia and myself holding up those AARP certificates. And as part of that, we did receive that flagship grant to conduct the digital literacy trainings and the access hubs. Okay, I think that's just about everything there. Any questions? I'm talking a lot. No questions yet? Okay. There we go. In mental and behavioral health, we have, so there's a goal of having programming and curricula in all our schools that incorporates healthy communication and conflict resolution. That is slightly updated from our previous CHIP's goal of K through 12 comprehensive health curriculum in all schools. DESE did update their standards, but in terms of having K through 12 comprehensive health education in all schools, that is currently unattainable, I will say. But we are working toward it in the way that we can by adjusting our goal to be having some healthy communication and conflict resolution in all our schools, and to increase training and support for trauma-informed care in our schools. We are continuing our active bystander trainings, and we are working with partners to bring I Decide, which is a diversion from suspension, alternative to suspension program for kids who have been caught with substances. And we are working to bring that and other programs and resources into schools, continue working with them as partners. Every school is in a different place. Along the lines of collecting youth risk data, the YRBS survey is the standard that we had been trying to get everyone on, but they all do a different version of their data collection in terms of youth behavior and risk factors. And so rather than fighting that, we are going to try and find some ways to tell the story in an aggregate way, even if the data is being collected differently. So that's going to be a bit of a project. There have definitely been funding and staffing challenges, both at the schools and at the organizations that are conducting those surveys. And so that's it's a little bit on pause at the moment, but we'll definitely pick back up again, hopefully soon. Partnerships, again, in progress with some populations, for instance, maternal care, as far as increasing access to mental and behavioral health services. So that will be part of the organizational work that we are doing in Neshoba and with Gardner and Haywood. And we do have some new programs. McPAP for Moms is a program we're hoping to partner up with. If any staff can watch the chat for me and let me know if there's anything significant popping up, because I don't want to go back and forth. Anyway, interrupt me if anybody says anything in the chat or there's a question that I need to answer. And so let's see. Again, so we are part of several advocacy groups, but we do not lead most of the advocacy around bills and other legislation. And so there is movement for community health workers that we are watching, but we are not leading. In addition, so improving social connectedness and economic opportunity is really a broad goal for mental and behavioral health. But we hosted our first social services networking fair in April, right after our legislative breakfast, and it was really fun. It went really well. It got wonderful response. And so it was the first of its kind that I know of, in our region at least. Rather than being a health fair that was community facing, it was really meant for our social service partners to network with one another, to get to know each other, so that they can do warm referrals, and have people that they've engaged with face to face. You just tend to do more referring if you've met someone. And so it was really successful. People had a really good time. There were about 30 organizations that participated. And so we will continue to do that. We're hoping on an annual basis. What else? Age and dementia friendly plans and services is part of our AARP goals. And so we are in the early stages of that. So we have, we're identifying some resources and programs for age and dementia friendly. And we have staff on board now who's going to be leading the Regional Coordinating Council and also working toward pulling together those age-friendly services that are not necessarily transportation, but connect to transportation, such as housing, and perhaps like in-home healthcare and other services, digital equity, other services related to aging in place and being age-friendly. And we also have a master's in public policy intern who will be starting with us very soon, within the next couple of weeks, for the summer. And he will also be working on our age-friendly plan. Stop me at any point if you have a question or a comment. Okay.
Just the thumbs up comment, Chelsea.
Thanks, Peter. As far as healthy and safe relationships go, this is an area where you see a lot of the hands icons. We do a lot of partnership support here. I am gonna say that honestly, the goal of the Health Equity Partnership is to be the convener and the support and the resources for our partners. And that doesn't always mean that we're leading an area of the CHIP. Sometimes it just means that we are providing space and or showing up in partnership. And we have really strong partners in the region that we have been showing up for. There is a really strong domestic violence task force in the region. The picture that is here is from the Pathways for Change International Denim Day event that we participated in, and Wendy and I performed in. It was a lot of fun. There are the YWCA is a really strong partner in this area, and so we are working with all of our partners. There have been a couple of areas that we have leaned into. One is bringing syringe service program and a mobile harm reduction program to the region, which a town decided that they wanted, passed an ordinance in the town to allow it, got Department of Mental Health funding for it, and then realized that there was no provider in the area that could do it. And so we did a lot of work to help them identify a provider, which turns out to be Community Health Connections. They worked through the process to become a provider. They had to go through some things to be able to do that. but they are now set up to do it. And the funding, meanwhile, was paused. And so now we're waiting for that funding to come back online. But there's been some progress in that area, because now if a town wants to do that and there is funding identified to be able to do it, CHC can now be the provider for that. So some progress anyway, that's a good thing. And I will make a note that there's a plus at the bottom here. That is a new area strategy that was added to the Community Health Improvement Plan based on feedback. So when we presented the CHIP draft, we got some feedback that there has been not enough and not enough quality data collection on sexual and domestic violence. And so it's being underrepresented and not showing up in the way that it needs to in the community health assessments. And so one of the things we've been asked to work on is how to do that better for the next time the triennial community health assessment comes up. So that has been added as a goal. Okay. Is Anne here yet? No, because she said she'd be on at 3. All right, I'm going to skip healthy food access for just 1 minute because Anne's going to come on at 3 to talk about it. All right. In racial and social justice, we have some cool things that have been going on that I'm excited about. The Anchor Collaborative, I will say, kind of started a lot of these initiatives as far as local and inclusive employment, and they are the reason that we leaned into transportation the way that we've done. Investing, they've done a lot as far as investing in community resources and really having what we call an anchor mindset, and adopting the anchor mission of using their economic power to recirculate dollars within the local economy. So always looking local first, basically, for hiring, for promoting, for development of human and other resources, investing locally, and doing as much procurement locally as possible. And so those are so much of what the Anchor Collaborative started is part of the core mission of the CHNA, that we essentially have just folded that anchor mission into the CHNA. So as opposed to having a separate group and additional meetings, we have taken those initiatives and moved them forward as part of the general Community Health Improvement Plan and CHNA mission work. So you may be hearing less talk about the Anchor Collaborative as an entity, but it still exists. It's essentially just folded under the Health Equity Partnership. Okay. There has been, okay, I talked about our new youth coordinator and our new ambassadors coordinator. We are launching, so one of the things we're pretty good at is being responsive when community comes to us and asks for something that doesn't already exist. We do a pretty good job of finding who could help with that. And so we did have some folks who came and said, we would really like to do something for our LGBTQ youth. We feel like there's a really big gap in the region as far as, yes, there are some school spaces, but they may not necessarily be accessible, appropriate, feel comfortable for all of our youth, and they tend to function as support kind of spaces, and not everybody wants support. Some people want a community that they're using for fun. And so we are launching a creative arts youth group, which is what our youth were asking for. And the first event is Pride Paint Night, which is going to be held at the Mock Youth Innovation Center. They're going to be hosting that, doing the instruction in Paint Night. We're going to be using that time for them to design the branding and logo and some fun stuff for the group. So the group doesn't have a name yet. The youth themselves are going to do all of the development. We're kind of just kicking it off with like the first event, and then they're going to take it from there. And we're working with several arts groups across the region. So each arts group will host an event once a month on the third Friday of the month. And the idea is that we ease the burden on each individual group, so we're not requiring too much of them, and also that we kind of move it around the region so it doesn't end up feeling like it belongs to any one town, so that it's the youth themselves that it belongs to. So we're really excited about that, and putting the youth in charge of what they want to do with it. There'll be all kinds of different events, from improv nights, karaoke, other kinds of arts events. Also, a community response is our partnership with HEAL on the HINT campaign. So in a HEAL meeting back in the winter, there was a lot of discussion around hate in the community, aimed at all different groups, primarily our immigrant population, but experienced by other groups that have been targeted. Our LGBTQ community also, and how do we really create a bystander response that feels as visible and loud as the hate feels, and so the HINT campaign grew out of those conversations. It stands for Hate is Not Tolerated. And the HEAL collaborative provided a bunch of resources in terms of putting together some trifolds, and the group developed these a whole bunch of different designs, and they are available. We made pins and stickers, and we've been giving them out in large quantities to schools and other organizations, and letting them kind of roll out the campaign at their own organizations. We'll be using them at tabling events, and giving them out across the community. And just recently we opened a web store that's off of the Chenaz website. And that has some cool like t-shirts and other merch that people can purchase that has the HINT campaign message and logo and stuff on it, as well as some other merchandise that will help fuel and fund the campaign into the future. So we're excited about that. Definitely want to shout out a thank you to Haywood, UMass, the Community Foundation of North Central Mass, and the Health Foundation for recent investments in community resources that are really moving all of this work forward. So definitely want to thank all of those funding partners. We will be continuing active bystander trainings. We have done some distribution of red cards, which are those Know Your Rights cards. And we'll be continuing to promote listening sessions, trainings, resources in support of our immigrant populations. Anybody have any questions about that? Anne, are you here yet? I don't know if Anne showed up yet. No. Okay. All right. I'm gonna go one more. Okay, so general CHIP support, not necessarily falling under any one of our categories, but in terms of our overall mission to elevate diverse voices, we are working with, of course, our youth council, and so that's Sarah there, and who also spoke at our legislative breakfast. The Youth Council has been running almost solely thanks to support from the Community Foundation. So we really want to shout them out and say thank you, because the Youth Council has been amazing. And I don't know, I can't even imagine us doing the work without them anymore. So we will soon be recruiting for the 3rd cohort. And the ambassadors, the program will be continuing under our new coordinator, Wendy, who I introduced in that staff picture earlier. The legislative breakfast was a success. It was packed, and the speakers were just amazing and really powerful, and they definitely connected with our legislators who were there, and very responsive and receptive. And so want to thank everybody who was involved in the legislative breakfast. The Community Foundation also sponsored the legislative breakfast and funded almost all of what it took to put that event on. So we're really thankful to them. We continue to show up in lots of statewide advocacy spaces and advisory groups as a voice for our rural communities. And I want to thank all of the Chenal 9 partners and members, because if we weren't hearing from you, we couldn't be in those spaces being effective. And so it's crucial that we are hearing from all of our membership and able to come to those tables and say, we represent 240 or so organizations in the North Central region. And so we know what we're talking about. And, so that it really matters that we have such an engaged community. And I also want to encourage anyone who has not done it yet to take the survey. It's on our website, and it's in the newsletter. We are going to be closing it out pretty soon, but we're going to be putting out a report on the impacts and potential impacts of funding cuts, whether they're at the federal level, the state level, or the institutional level. We think not enough people understand in general kind of where the funding for the programs that people rely on comes from. I don't think most people understand that libraries are largely funded by federal dollars and not necessarily their town municipal taxes or like random grants from private organizations. I don't think people realize that their all of their health services are jeopardized when there are significant cuts to Medicare and Medicaid. Even if they are not using those services, they push people into, they will force some healthcare organizations to close their doors, and they will push other people into the private systems that are already overburdened. And I think we just need to do a good job of telling the stories of how important the funding is, and where it comes from. And so I think that's important both at the legislative level and at the public, the general public level, because so much of public health is kind of a mystery to the general public. I don't think most people could even identify more than two things that public health means or does, and that's that makes us vulnerable, right? Because if you're not seen, then you're not prioritized. So please take that survey if you represent an organization, and what else? I have thanked Sarah for the amazing work that she's doing in communications. Our mini grants are almost expended for this fiscal year. So if you're an organization that has a small project, mini grants in general are up to $2,000 for a short-term project or investment. We've awarded 10 to date, and our fiscal year ends at the end of September. So we only have about $1,600 left in that fund, but it will renew again. So if you have a project that maybe doesn't get funded now, but can take place in the fall or later next year, be thinking about that. Feel free to apply at any time. We take them rolling. What else? All right, I'm gonna go back to health, to healthy food access. And if Anne doesn't get here, then too bad, I'm gonna go for it by myself. So, and I don't wanna steal her thunder is the thing, because Local Food Works has been doing some amazing work. So that is a partnership between several organizations. Growing Places is the backbone of Local Food Works. It is a partnership with the Chenal, with Central Mass Grown, and with the Montechusett Agricultural Alliance. And so those organizations, together with other groups, represent Local Food Works, and that is has been designing a holistic, equitable food system for our region that is self-sustaining, and we are in year 3 of a 5-year plan to get to self-sustaining. So we're not there yet. We're still in we need funding and grants, but we are moving in that direction. And so part of that has been working with our Anchor Collaborative and other partners to become institutional buyers of the produce that Growing Places is aggregating from 28 local farms, and several farms that are regional but not local. And so that aggregation and distribution was kind of the critical linchpin that Growing Places provided in order to really make this whole thing work, so that our small local farms can be selling in our region, because they can't sell to our institutions individually, because our institutions could not manage 28 different contracts with local farms. And then call them all and find out if they have squash or apples or lettuce that day. So Growing Places has really taken on that role, and our institutional buyers have been fabulous about working through the early stages of how this ordering is going to work and how delivery is going to work. And they've been patient and wonderful with feedback, and really committed to purchasing locally and making it work. And that's been hugely important to the success of the project overall. And so we are now moving into a phase where we're ready to roll that out to other kinds of buyers, so smaller like stores and restaurants. And so there's been a lot of really cool movement there, and we're really excited about it. We're developing some good communications material so that people can, we can hand out flyers so that folks can get into that ordering system. And in the food space, we have also been working. So we had some setbacks with the Healthy Incentives Program at the state level that ran out of funding. It didn't run out of funding. It was going to run out of funding. And so instead of doing supplemental funding to get it fully funded for the year, they decided instead to cut the benefit down to $20 per family, which is ridiculous and not even worth using for a month for what you have to do to get it. And so that really kind of threw like the whole system into a tailspin, and cost growing places a bunch of money because they were managing those HIP contracts for people. And it was really a mess. And we did a lot of legislative awareness building and campaigning for HIP. And so successful and unsuccessful. So we were successful in all of our legislators understanding and supporting HIP and being really supportive of it in general, to the point where it is now going to be fully funded at the requested amount for FY26. That is a win. We are happy about that. What it didn't do was get supplemental funding for the rest of FY25, which was requested, but essentially just time ran out. You get to a point where like you're already in the growing season, and it essentially stopped making sense to even ask for it, because it takes like a month to get it ramped back up in terms of the system and bureaucracy. Anyway, so it didn't end up going into the supplemental, but it will be fully funded in FY26. And now the goal is to have HIP be codified into law so that it becomes a program that is funded every year and not something that we have to fight for every single year to get included into the budget. And I do think that that's actually going to happen this legislative term, because I think that it was pretty catastrophic when it ended the way it did, and I think that our legislators really realized that in a way that that they probably hadn't before, and so I think they're gonna do it this time. So bad things happened, but I think they might lead to good things. And there was a lot of local advocacy that happened there. North Central Mass showed up in a big way. We were really proud of that. There was a whole caravan of people who went to the lobby day for this. That's me with Kim Ferguson. So it's really got really broad support in the legislature. I don't know anybody who's against it, so I think it'll go this time. Any questions? Anybody want to talk about anything else? I know I went really fast. Lots of good stuff. Really. And I want to be really positive because there's some headwinds, right? There's a lot that's happening. There's a lot that people are maybe afraid to like move forward with because funding can be really uncertain at the moment. And I just want to congratulate everybody in North Central Mass because I really feel like all of our organizations and our community members and I feel like it's been like a COVID response. Like people have come out and stepped up in ways that so quickly and willingly and just out of their comfort zones and like standing in the gap. I mean, that's that's the phrase, right? Is there are just so many people willing to stand in the gap. And I'm really grateful to our whole region and our whole community. I don't know that every region has been able to do it the way that North Central has. And I'm just really proud of us. I think North Central is doing great things.
I would agree, Chelsea. I think the one thing that is certain is that the will behind the scenes and the people that are happy to step in the gap, as you say. And I'll be very, very frank and say, I really think that is a function of the leaders in our region. And I'm going to put you in that bucket because if the right motivation and the right vision is there, people will step up. But there's always going to be uncertainty. What we need to realize is that what we want to happen and the equity and everything else that we're looking for is a certainty. And it may take us longer. There may be some hurdles or some roadblocks there, as I feel that there are now. But we just need to figure out what's the kids' book. You go under, you go over, you go around, you crawl through the mud, whatever it is. I think. But
Under, over,
yeah,
around, and through.
that's the one. That's the one. I gotta find that one for my grandson. But good for you.
Thank you, Peter. I appreciate that. And you missed I waited for you. You were the last slide. Anything else you want to say, Anne, about I went over HIP and where we've landed with it. I went over local food works and the amazing work that you've been doing at Growing Places. We talked about the maternal care project. Anything else you want to talk about?
I would just say that our Fresh Box program that we had been doing for 3 years, the administration changed its priorities, and so we were purchasing $9,000 to $12,000 worth of produce a week from our farmers, and that money went away. And with the HIP cuts, we and our wholesale sales, that's where I was ordering with my team. We on average are only ordering about $3,000 right now worth of produce a week. And so it's pretty devastating to our farmers. And it's also pretty devastating to the community who's not getting all this produce now that they were actually eating. So, we're doing the best we can to increase our wholesale purchasing. I think consistency is key, and buy-in from our institutions. If you have an institution, we've been wholesaling now for 2 years. We've got it down. We're good at it. We just stood up our processing center. So email me. It supports your local farmers, puts money in your economy, and it just tastes better, honestly. And most of it is either sustainably or organically grown with love, which is very different from typically what you get. So just let me know if you're interested. And also we always have our home delivered SNAP HIP program. That's why we want the HIP funding. that you shared that the amount will go back to $40 a month in July, Chelsea?
I shared that it would be fully funded next year. I forgot that it would be back up to $40 in July.
So, yeah, so unrelated to actually the fiscal year funding,
Yeah.
they're going to increase the amounts back up to $40 at least for everybody. It was 46 or 80 depending on household size. So those families of 6 or more are still only getting $40, which was half the amount for the month. They comprise
But it's
maybe
better than 20.
20% of all of our customers, right? Both those camps. A lot of the people actually who get our home delivery program are 1 or 2 people. So going back to the $40 is really going to help them. It's also going to double the amount we're purchasing from the farmers. And although not a ton, it will get us back to probably $4,000 a month of purchasing instead of 16,000. Oops. So, it is what it is. We keep slogging along and going with the tides. So, just, again, if there's a way to tap in, shoot me an email. That's it.
And is there, do you have it set up so that people can gift a subscription?
We could definitely do that. So we have a way for people to sign up through credit, and then we could identify a family that could use it through our food pantry friends, our emergency assistance friends. The other one is I see Selena. We have our hospitals that we work with, and we have our food is medicine program. So we could probably identify a family with Haywood, right? That would benefit, or through Heal. So there's a million ways we could. So if you want to do that, yes, we could do that. There's no bespoke program though that is buy one, give one. Just because we have so many distribution channels and programs that's
Right.
not what we've gotten to yet. But we could do one-offs, absolutely. Yeah.
Okay, good to know. So as we develop communications and things, we can talk about what we want to promote that will help that. All right.
Yeah. The other thing we could do is
yeah.
we could just see how much people donate, and we could give the food pantries that amount in bulk, so they could just give it out, which would be easier than doing it for a family. I would prefer to do it that way. And then we could designate a food pantry in each region, right? And rotate it around. I would prefer to do that. Like I said, it would be easier for everybody. And we already have the systems in place from the Fresh Box program. So let's talk about that.
Okay.
Okay.
Yeah. Does anybody else have questions, thoughts, ideas? We're gonna end a little bit early, which is good. A lot of good things happening. Anyway, I was saying, and I think you were coming in just at this time. I was saying, I'm really proud of North Central. We have pivoted so many times at this point. We're really good at it. I was on a call with the New England Regional at the New England Rural Health Association, and they were saying that's one of our strengths, that we have pivoted several times, to make the best of whatever is happening and take advantage of and move whatever can be moved in a positive direction. And there's definitely things that are suffering along the way and things that are getting worse instead of better. But there's other areas where, we're really making good changes. And so can't ask for more than that. All right. Everybody go get some sunshine. It's beautiful out. See you soon.
Bye. Thank you. Great job.